introduce you to our speaker. James Hattersley has over 25 years of life science leadership experience in business and corporate development capacities, and currently serves as Adherium's Senior Vice President of Business Development for North America. Let's welcome him to the stage.
Thanks, Jill. Well, thank you, Jill. Thank you very much for the nice introduction and for the invite to be here at Digital Health Summer Summit again. In the interest of time, I think maybe we should just jump right into some of the attributes of what we're really looking at here within the digital health platform regarding respiratory and asthma COPD. Let's see here, do I have the capability to... Yeah, Adherium's value proposition, just to speak about the value proposition, I probably should step back just for a couple of seconds and say that Adherium is a company that's been in this space for about 17 years. It was founded by our CEO, founder really, Gar Sutherland, who's a chronic asthmatic by background. He's a physicist by training. He was at Microsoft for several years. And really, back in 2000, 2001, was interested to just sort of follow what it was that was happening with his medications for asthma that he's had ever since he was a child. So the company really evolved into what it is today. This is a publicly listed company on the Australian Exchange. It's headquartered in New Zealand. We have our North American US operations in San Mateo, where I'm based, and we've also got an office in the Netherlands for the European side. But in terms of the value proposition, we're really looking at the patients, the payers, and of course pharma, where the products come from. I'll get into a little bit about the actual device in a few minutes, but being able to look in terms of respiratory, and again I'm speaking not about bronchiectasis or CF or some of the other conditions that we could apply the technology to. I'm speaking primarily about asthma COPD. Having an early identification of patients with poorly controlled asthma is really a key, so we can sort of see what it is that's happening before it really gets to be a major problem. And if it does become looking like it's going to be a major problem with the provider or the physician's involvement, we have the capability of turning on an intervention, or what we call these activation reminders, within the device, not on the phone. And I'll get to that in a few minutes, but there's so much activity going on with the iPhones, the Androids, that we have found over the years that having the actual reminders, whether it's in your purse, your backpack, your briefcase, to have those reminders sort of beep, 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 beep. You'll want to pick up the device, you'll want to turn that off, and you'll want to use it, and that way you've got an effective use over the one puff per morning, one puff in the afternoon, or whatever the indication requirements are coming from the physician as far as the dosing regimen. So we have the early ID, we've got the ability to have activation of the reminders, and then sort of track that and watch that over time from a provider's point of view. The ongoing support and maintenance of the services, because data is really what's important here, not so much just the device that goes with the inhaler, but the data is something that we would watch and that we have some oversight on. Data encrypted, that is, HIPAA compliant, but the ability to be sure that the device is operating the way that it should be operating, and also that the data that's being collected is going to be effective for use by the provider. So I really kind of broke this up into a couple of pieces: the patient experience, the provider perspective, and then a little bit about the data. And if there's any questions, we have time for questions at the end. I can surely answer those, or we can take some of those offline if we have more time. So there's really two parts to it, meaning the hardware and the software. I've just put one picture up here, one slide for the interest of time, to show some of the products. They look familiar to you on this slide, that are dispensed from the pharmacy as you know them today. These are meter dose inhalers, they're dry powder inhalers, there are some of the newer systems like the BI Respimat system, and down in the right corner you'll see the Symbicort product and the Symbicort Smart Touch device that we have from Adherium. So you've got the products, the inhalation COPD products, and then you've got the devices that go with them. We have devices for some of the most major products. We don't have devices for every single product that's on the market, but an entirely different presentation could get into the insurance companies, the formularies, the plans that are most prevalent, and what the preferred products are on those plans and which ones we target and why we target them, whether they're reimbursed with a CPT HCPCS code or they're adopted as part of a plan. So there's a lot of involvement, a lot of engagement there I don't want to get into in this presentation, but that's something that we have to keep our eye on, and we speak to the payers and the PBMs quite a bit about. So anyway, these are the hardware systems that we would link together or pair together with the products. Hardware is one side of it, software is the other. We're looking at different capabilities of what the software can do, attributes in terms of patient engagement. I came into this, I've been in the industry for, as Jill said, about 25 to 26 years. All pharma, all biotech, was at Apple Laboratories very early in my career, and have moved to some of the larger and mid-cap companies along the way, a couple of them. And when you take a look at what patient engagement really means, I come into this a couple of years ago thinking that most of this is obvious and it's very straightforward. It's not so obvious and it's not so straightforward because people are using software in different ways. There are different types of attributes that people like to see. So while we've had something that's been a full solution and very successful from the clinical side, when you get out into the patients and into the consumer side, consumerology, consumerism, it's important that we address some of those factors from a software point of view and the integration of the software with what we think the patients are going to like and use, as well as what the payers are using, for instance, because they've got software that's been developed for their lives and in their populations per payer. So that's very important that we're able to integrate into that. So we have the Smart Chat library. That just gives the ability for some of our third-party software developers to link very well with the smart inhaler device. The apps, of course, are important on the phone so that it's clear what is being communicated from the device to the phone. And then what we call Smart Inhaler Live Cloud, that's the ability to download and look at data, generate reports, and have the ability to take a look at what the trends are looking like per patient and where there may or may not need to be any intervention. So the hardware, the software, and then really the combination of that is a combination of technology platforms, whether we're talking about medicine, microprocessor, wireless communications, or the internet. Those four pieces together really make up what Adherium was founded around 17 years ago. Now this is really a quick snapshot of a dashboard of what the phone looks like. If you're looking at the app that you've downloaded onto your phone, onto your iPhone, you'll see on the left side a nice sort of picture of what is prescribed. I think it's very small. I'm not sure if you can read that on that larger screen, but you'll see what is, for instance, today AM and PM prescribed and what the total is. So what's prescribed, what's actually been taken, and adherence. This is actually an example of a pretty decent patient, a pretty adherent patient, if you will, that is taking the 2 doses in the morning. And by the way, they can set the time that they'd like to take these doses in the morning. They can set it for 8:20, they can set it for 9:15, 2:40, 5 o'clock in the afternoon, whatever it is. So whatever they think and whatever their provider thinks would be the best timing for them based on their lifestyle would be something that can be set by them very easily. And then the device will prompt them or remind them to use that effectively, at those times. And so this patient has been very effective at doing that. The 2 middle snapshots are really a data point graph and then a bar graph that shows the data as the patients have used it over a period of several days. So pretty decent, very compliant looking patient. What you're seeing on the right side is peak flow, so FVC, FEV1, spirometry data that goes hand in hand with the actual adherence to the medications being used by the patient. So you're using the product, you're using it effectively, and then you're showing the proof of it trending in the right direction for having the proper spirometry characteristics. Patient monitoring capabilities, this is maybe more a little bit from the provider side of view or from the physician's point of view. I wanted to just maybe use a couple of examples here, and these are, of course, encrypted. There's no disclosure here that we have to be concerned about, but these are a couple of graphs of real data. This is a data point that is an adult asthmatic. You can see over the period of this month, this is a very highly non-compliant patient or non-adherent patient. I might want to clear that point up as well. There are discussions around compliance. There are discussions around adherence. Compliance is generally conceived around a physician, for instance, that prescribes a medication to you, and you decide when you get over to the pharmacy that you don't want to have it filled, whether you don't want to make the co-payment, you don't like the adverse event profile, you don't want to have to be on a product for any period of time because you think you're generally okay. That's really patient compliance. You never actually ever got it filled, and so you're a non-compliant patient because you just didn't get the medication, even though a lot of, there are many prescriptions, millions of prescriptions are written per year, and they're never filled. Once you have it filled and you take it home, whether you use it effectively or not, that whole world is adherence. Whether you use it properly, you use it effectively, as it's intended by the physician, on time, repeatedly, dose refills, all of that is what we have focused on with the use of the smart inhaler technology and the products as they're dispensed. So here we've got an adult asthmatic patient. This is 1 puff in the morning, 1 puff in the afternoon. Ventolin rescue as needed. Ventolin or the rescue would be shown in blue. The preventer or controller medication is shown in red. And highly non-compliant. days without drug, a couple of doses of rescue medication, a few other doses that are highly overdosed on the preventer medication. This is an example of what it looks like when a patient isn't compliant, is compliant but isn't adherent, and winds up going to the emergency room for an exacerbation likely. Take a look at this graph. Now this is a younger patient. This is an adolescent patient that is maybe more tuned into listening to directions. They also have a parent that's probably overseeing how they're using what they're using for their asthma. 2 puffs in the morning, 2 puffs in the afternoon. Again, the red is the maintenance medication here. This was Symbicort. This is a product that has been developed and commercialized by AstraZeneca. So this is Symbicort, and you don't see any rescue medication used at all. Very effective patient, very effective use of the product, and no use of the rescue. So I would say the adherence here, if you look at the top right, is about 95 to 98% total, 100% in the morning, and maybe a little less adherent in the afternoon. And that's, again, if you kind of step back and you put the data that you saw on the dashboard and the data you just saw a couple of seconds ago, this is on the computer screen of what the adherence data looks like, as well as the spirometry data. So everything is loaded up there, and you can see everything at one time. Again, from a provider's point of view, with the integration into an EMR system, this is what a physician would be able to pull up and look at with regard to that patient and decide whether they need to have further disease management activity or this is effective for them. Because, as I mentioned a little bit earlier, you've got the product that's dispensed from the pharmacy. That is a product, and you've really turned it into a disease management system by use of the smart inhaler technology. I think maybe one of the slides may have been lost here, I'm not sure, but I was going to do a quick, kind of a quick show and tell, since I'm talking about the smart inhaler technology and I'm talking about the products that are dispensed from the pharmacy. I don't know if you can see this. I think he was able to do it. This is the Symbicort product that is dispensed from the pharmacy. We have a global agreement with AstraZeneca for development and supply of both the Symbicort, smart inhaler for Symbicort, and also Bevespi that has just been launched back in January for COPD, so an asthma product and also a COPD product. That is a standard product, an MDI type product you would see dispensed from the pharmacy, a tethered cap as required in the United States, dose counter on top. This is the smart inhaler technology that is supplied by Adherium. So you can see it's very much the same in terms of physical configuration as the product dispensed in the pharmacy. There's a little door that you open up. And by the way, this is used over the period of 1 year to 2 years on a battery or 3 to 5 years on rechargeability. So these are very, very effective devices that are just about nearly foolproof in their use. You just open that little door, you take the Symbicort product, snap it in, close the door, and there's a little pairing button in the back. If you look at the back here, and you'll see that it was paired properly, there would be a little green light that kind of blinks right here in the front. That goes for reminders, that goes for pairing, that also goes for battery check. So once that's done, within a couple of seconds, you're done. It communicates directly through low-energy Bluetooth with the phone, and from the phone then through Wi-Fi, SMS, or MMS goes directly to the cloud. And from there, you have the capability to do any downloading of reports and generation of reports to monitor the patient's condition. So a very easy, very effective system to use, and as you can see, very seamless, almost like a hand in glove. There's nothing onerous about it. It's not meant to be universal across other devices. There are other devices that we have that fit MDI systems, like a Ventolin or a ProAir or a QVAR. Those use actuator housings, if you will, that have the canister in them. Those actuator housings are nearly identical. So we can use the same Smart Touch device, if you will, for that, but not the Symbicort Smart Touch, and Spiriva HandyHaler, and sort of the list goes on. So that's what we've done with our devices. Much of the software is pretty much unchanged. Outcomes data, probably the most important part of the presentation. I won't go into a lot of detail on the clinical studies here, but these are randomized clinical trials. I wanted to put up one slide. There are other randomized clinical trials as well, both in pediatric and adult patients. But the most recent and probably one of the more impactful studies that was just published in Thorax, the others are in Lancet and the Journal of Allergy and Clinical Immunology. All peer-reviewed, very highly respected journals. This Morton study, this Robert Morton study that was done in the UK, Very impressive in that there was a 43% increase in adherence by use of this smart inhaler device, an 80% reduction in hospital visits, 80% reduction in hospital visits from the control group versus the smart inhaler group. 39%, 40% reduction in oral steroid use. That's an important point because usually an increase in oral steroid use is an exacerbation on the move about to come within the next hours or maybe in the next day, depending on the condition of the patient. Secondary or tertiary endpoint was a 15% reduction in school days. But what's very important from an outcomes point of view and from a cost point of view is that reduction in the 30-day admit, especially the quality of life for the patient, but the 30-day admit on the hospital, the emergency room visit, and the exacerbation that really comes from the excessive use of corticosteroids. So there are publication references and background that we can surely provide a lot more information on. Amy Chan, Juliet Foster, these were two additional studies that were done in Juliet's in adult and Amy in pediatric as well, previous years, and not too far ago. I'd say I think Juliet's were a couple of years ago, Amy's a couple of years, maybe a year and a half ago, and Bob Morton was just last year. This is a very interesting, this is not a study that we did, but this is a very interesting slide that I thought would sort of validate a little bit further, fully validated everything that you've seen in the smart inhaler technology, but this is a study that was done 2009-2010 timeframe by a physician, Vespo, and this is over 6,000 patients done in Europe, over 6,000 patients. You take a look at this data, and just like what we've seen in all of our studies, when you are at least 80% adherent or better, you have a reduction of about 60% in a mortality rate or potential mortality rate. This was followed over a couple of years, and the drop-off occurs fairly precipitously when you take a look at people that aren't adherent or are below 80% adherence. You are jumping up to about 25 to 26% increase in mortality rate as opposed to being adherent. That goes as well for the annual rates of hospital admission from an exacerbation. You go to the hospital for an exacerbation and you're not 80% adherent, there's about a 27% chance you're going to be admitted. On the other side, there's a 44% reduction. There's about a 15% chance you'll be admitted if you're adherent. So when you take a look at this data and you really study this paper, and they report hazard ratios, this is like oncology. I've got a certain amount of background in oncology. Two primary chronic therapeutic areas have been respiratory and oncology. So you're looking at overall survival, you're looking at Kaplan-Meier curves, you're looking at hazard ratios. Has a hazard ratio of 0.4 with a very strong p-value. If you've got something like this happening in the respiratory sector the way you do in oncology, these are par of being blockbuster type drugs without having a new molecule being developed. So extremely important, extremely impactful, very well aligned with the data that we've seen in our studies. And this is a much larger study that was done a few years ago, but very important to put this up and note just for a couple of minutes.
Oh yeah? Yeah, that's perfect.
Device reliability, I just touched on very quickly a few minutes ago. The devices are very reliable. They've been tested in these studies by a series of investigators. Again, won't go into detail, but I will say that it's even impressive for me to look at some of this data because these devices, unless you drop them in water, put them in the wash machine, drop them in the toilet accidentally, aside from those kinds of things, you're 98 to 99, almost 100% accurate every single time over a period of several months or years. So the devices, for all purposes, are nearly foolproof. Additional clinical trials, we've done trials in clinical programs in COPD and asthma, so these are just some upcoming trials that will be completed in 2017, 2018, that will total about 1,100 to 1,200 patients, and I would say stay tuned in terms of being into looking at some of the data next year. I think this will just be further validation of the use of the smart inhaler technology in COPD. The picture on the right, again, on that slide, I think that was missed. You can see some of the patients here. They're not always so young. They may be a little bit older, and at times older, they also don't have phones. So those phones aren't really necessary for this to be active. There can be what's called a home hub plugged into the wall, or the information can be downloaded directly from that smart inhaler device to a computer. It doesn't have to communicate through low-energy Bluetooth. So there is the capability for anybody's situation or lifestyle, whether they have a phone or don't have a phone, to be picking up the information and be able to communicate that information to the cloud. So in summary, I think, in total, I just wanted to have the point come across that patients are poorly controlled in general. As Jill mentioned a little bit earlier, we're talking about 50% or less adherence, and that's just across the board once people have their prescriptions prescribed. Despite training, despite the types of medications that people are using. Very interesting to hear some of the case studies from pulmonologists, physicians today, 10 years ago, as well as today, just a few months ago, talking to physicians and even some pharmacists about how people, even when trained, don't use their drugs properly or their devices properly. So this makes it a lot easier for people to be both compliant and adherent. All of the data you've seen are outcomes data. These are outcomes-based clinical data that has a major impact on the ability of the patient to have a solid quality of life, much better than they would have otherwise. The impact of the healthcare system, the cost reduction on the healthcare system. They love these devices. They want to see a lot more of them. And of course, the pharma company from a prescription refill rate that would be routine and on time the way it should be. So I think from a conference like this and from the folks that you're seeing in these different sectors, not just respiratory, the industry is moving in one direction very quickly, and we feel very grateful to be part of it with the contributions we've done over the past 17 years. And on that note, I'll leave it at that if there's any time for questions. Otherwise, thank you very much.